Thanks a lot for inviting us to be part of the Maternity and Midwifery Hour for a second time. I know Jenny has done it more than I've done. I think this is her third. So today we'll be talking mainly about the unscripted role play that we have included in our research project. In order to explain this role play, I need to give you a bit of background on where this research has first emerged. It was a Royal Society of Edinburgh workshop grant in 2022 when we started working with Jenny on this subject. And the project was titled Translating Informed Consent in Scottish Maternity Services. And this project, we explored understanding of informed consent for parents with limited English proficiency. And to do this, we held online focus groups and in-person interactive workshops, which were facilitated by Active Inquiry, which is a theatre and arts company based in Edinburgh. And both in the workshops and in the focus groups, we invited maternity care professionals, mainly midwives, student midwives, researchers in midwifery, translators, interpreters, some doulas, and researchers in translation and interpreting studies.
So the summary of the research that we carried out in 2022, the findings have been written up, and one of the papers is now published, the other very close to follow. But the main themes and sub-themes that arose from our study are these. So we have the focus around the resources and the limitation of those, and this includes time, the materials that are available, and whether in fact there is access to an appropriate interpreter. We had interprofessional concerns where primarily the maternity care professionals would have some concern whether the interpreters had the appropriate knowledge or training in midwifery and in the particular context, but also an understanding around the nuance of language, and that's from the maternity care professionals needing to understand nuance of language in different cultures and different languages. The whole cultural background, cultural awareness is something that we all need to really focus on, and that really came up as a factor. Different levels of health literacy amongst women and families, and the expectations that different cultures have around health and maternity care. And also a theme around power, shame and fear. So when somebody's unable to communicate or is listening to a language maybe from an interpreter that's maybe from a more politically strong location in their area, and then shame and fear can really be part of their experience. And then the whole thing of the experts in terms of maternity knowing more. So these were the key things that came up. Could I have the next slide, please? So the results of that study, that's a very brief summary, but we have already presented on maternity midwifery just over a year ago, 2 years ago now, and this is the link to that previous work if you want to follow it up. So next slide.
In terms of the publications, Jenny just mentioned that we had two outcomes. One has just come out literally 2 weeks ago, and we have already sent the details to the organizers of the Maternity and Midwifery Hour. It should be in your resource package. And the second one is in press. That one is focusing more on the legal and ethical aspects of informed consent in maternity care. One outcome of our first project was that there was a lot of emphasis on the need for discussing these issues antenatally. So whenever we were holding a workshop or carrying out the focus groups, people were saying to us, but these things should have been discussed antenatally. So as a result, there's a current project going on, again, supported by the Royal Society of Edinburgh. This is a research collaboration grant, and we titled it The Beginnings, Factoring and Interpreting Within Antenatal Care and Midwifery Education. So in this project, I'm looking at ways of accentuating language needs and thus streamlining access to interpreting services antenatally. This is, again, mainly based in Scotland. There are two systems in place at the moment, at least two systems. One is BadgerNet, mostly in the Glasgow and Greater Clyde area and partly the rest of Scotland, and the track system, which is being used in Lothian. And we know that the language needs are sporadically signaled on these systems. So I'm trying to find out how to make the section on language needs compulsory in these systems, clear and accessible for all the healthcare professionals who are supporting the parents throughout their pregnancy, perinatal and postnatal care. It's proving to be slightly more difficult than I thought, but there's some progress. And the second strand of this project is investigating the optimum ways of incorporating language and cultural awareness training in midwifery education in Scotland on a permanent basis, so not outsourced, basically fitting into an already busy curricula, but making sure that it will be included each year for midwifery students. So this was the background of the workshops that we will focus on as part of our talk. The workshops, we started doing them in 2022, and we carried several workshops in Scotland mainly, but we were also invited to Germany as part of a different project. So I have carried out some in Leipzig. What follows, we will just give you some more information about what these workshops were like and what was the feedback for these workshops.
So the workshops vary in their duration. So some of the workshops have lasted only an hour, and that timing is limited by the event that we've attended and the available space. Ideally, 2 to 3 hours is probably the best we need to make these work well. Around 20 to 30 participants makes the workshop feasible, and it gives a good interaction between several people. We start with some sort of attentive listening exercise, an icebreaker, just something to get people a little bit relaxed and to think about language and communication. Then we start some role play. It's unscripted role play, so we don't have a plan. We have people with, we provide different characters, such as midwife, the labouring person, woman, the partner. So we'll ask maybe 7 or 8 people to take on a character. We have scenarios written, but we also, especially in the longer workshops, we can ask the participants if there's a particular scenario they'd like to explore. And then each participant takes on that character, and we start to role play this scenario. And during it, we can stop at any time. We ask those who are observing to comment. We ask people who are participating in role-playing to explain how they feel and what thoughts are coming up. So it just really kickstarts conversation and helps people to be in different shoes and understand from a different perspective. In a longer 3-hour one, we also included what's called a stuck exercise, which has been used in nursing. And it's a sort of reflective exercise that allows us to explore how we feel in a particular situation or environment, reflect on personally what that means to us, and how that might impact going forward.
I think here it will be good to compare what we try to do in these workshops with the more scripted role play, which we are aware that is part of the training that is offered to healthcare professionals. I have been lucky enough to observe such scripted plays in a variety of settings, and they obviously have their very important educational benefits and significance. The importance of unscripted role play when compared to the scripted ones, I think, is it gives the participants an opportunity to base their responses on their own experience. So, for instance, when the student midwives are part of the workshops, they were saying that, oh, they have seen such a situation in their, for instance, placement, but they didn't have a chance or the time to debrief about it. They didn't have a chance to talk to anybody about that particular experience working with an interpreter, for instance. So they are able to benefit from their own experience rather than just reading a scripted play. As Jenny mentioned, it gives the people chance to step into someone else's shoes. So we had midwives acting as the interpreter and saying, oh my God, I never realized, even the turn taking might be an issue, who you will address, who in, whose eyes you will look into. Or we had interpreters acting as an anesthetist, and they were saying that, just embodying that experience made them understand how stressful the situation can be for a really busy anesthetist. And as a result of all this, we find that the responses of the participants seem to be less rigid and more embodied. We invite them actually to move freely in the room, to take, the birthing person usually takes suitable position. They are either, laying on a chair or making all the sounds a birthing person does. And it just helps everybody to really get into the mood. And then the freeze and debrief time Jenny mentioned. So when we notice, as facilitators, me and Jenny, when we notice that there is a particular moment in their acting that needs input, either from themselves as the actors or as the participants or from the audience, we just go like, okay, please, let's stop and freeze and talk about it. And we ask them, what they may need, what would have helped in the situation, whether they're afraid of something or whether they are concerned about something. And then we can ask the same things to the audience. So the audience has the chance to say what works and what doesn't. And as a result of that, sometimes, not always, but we can invite the audience to take over certain parts. So we say, would somebody else like to take over the part of the interpreter or the midwife? Sorry. Yeah. So we find that the whole workshop becomes more dynamic, fluid and open-ended, so a bit more malleable in a sense. And quite often they are quite fun, so possibly more memorable. Basically, in the Maternity and Midwifery Festival last week in Edinburgh, we had people knocking on the door saying, could you please keep it a bit quiet, because there was so much laughter going on. This is probably the advantages of having an unscripted role play.
So in part of what we're trying to do is we wanted to try and assess the impact of the workshop. Is it beneficial? So with one of the longer 3-hour workshops that we did, we put out a pre-workshop survey, and we basically just were asking those who booked to take part what did they think this workshop was about, what were they hoping to get from it, and a little bit about how confident or not they already felt in working with women and parents with limited English or in working with interpreters. So we had some data at the beginning, and then after the workshop we asked again, now what's your level of confidence now working with the women, working with interpreters, and any changes in your understanding around some of the needs that might be here. And is there actually anything that you might start to do differently day to day as a result of taking part in this workshop? Come on, the next slide, please. And so some of the outcomes is some of the findings that we had from here. So in expectations, people wanted to learn about communication. They wanted to look at support, understand a little about the relationship. Well, there's so many different dynamics and relationships within these scenarios. Confidence and understanding. These were the things they were hoping to explore, and we've got resource there as well. And we have developed a resources list that keeps growing with every workshop because people keep adding to it for us. In terms of the before and after regarding confidence, you can see from here that the blue is in the top one is extremely confident. We didn't have anybody who was extremely confident at this point. But we had quite a few people who were somewhat confident and neutral and somewhat not confident. And if we look now to after, we can see that those who are somewhat confident has more than doubled. So, the people that were neutral are about the same, but there's a move from those who weren't feeling confident before. Quite a lot of them started to feel a little bit more confident. So that was just a first initial sort of run at this, suggests that the workshop was beneficial. Sorry, next slide, sorry. Sorry, you did. The confidence in working with interpreters. So that was in working with people. And then the confidence again, we can see that there's a shift from that somewhat not confident. A few people have become more confident, and some of the ones who were a bit neutral have moved as well. So that increase in somewhat confident from 5 to 14, and somebody became extremely confident. So again, in both directions, we've got hopefully a benefit from taking part in just a 3-hour workshop.
In the 3-hour workshop we held with the Napier students, Edinburgh Napier students, we asked them, how has this workshop changed your thinking around language and cultural issues and around working with the interpreter? And these are some of the keywords that came up with that feedback, from that feedback. So they were saying that they are now hopefully going to be more aware of cultural differences, different perspectives. They said they will be more inclined to ask for extra time in appointments that need interpreters. They wanted to be more aware of body language and where they stand themselves as midwives, where the interpreter should be, how the turn taking should take place. So these were the areas that they said their thinking has changed. Mainly it was coming down to knowledge around interpreting and language issues. And in terms of specific codes, when we asked them, will there be anything you do differently? They said, the first one of the quotes was, the first thing I'll change on my practice will be looking at the woman rather than the interpreter, because there's this human tendency that you are actually looking at the person who talks, but in the interpreting profession, the interpreter tends to talk on behalf of the woman, so the interaction might go easier if the eye contact is between the healthcare provider and the laboring woman. But at the same time, they said, we will still be mindful of all the parties, including the interpreters, including the partners, including student midwives who might be in the room. There was quite a bit of emphasis on using props, for instance, on in terms of images, or in terms of other aids that might come in handy if there is no immediate interpreter or translator is available. And most of the students said that we need to use some creative thinking. For instance, if the phone connection with the remote interpreter just breaks down, or if the interpreter cannot be found in time. And another important feedback was to make a conscious effort not to simplify information if you are working with parents with limited English proficiency, or to infantilize them. Because in one, at least for me, one very memorable workshop scene, the student midwife who was trying to support the laboring mother was literally saying, it's all okay several times, but not necessarily giving the information the mother needs to calm down and to be still in control of the situation. And we realized that she's actually using the body language, the pitch, the tone of voice, and the short sentences that you would use to a child when you're trying to explain something. So there's this inclination on behalf of people where there's a language barrier, you think you are talking to a child. So they said that they will be more conscious of this in the future.
So in terms of what was most interesting, the feedback we had, and one of the things that we've mentioned is being in another person's shoes and seeing other perspectives. That, people were really talking about how beneficial it was. It's, initially when you're asked to role play, many people get a bit nervous and anxious and maybe a bit shy, and that's why some of our icebreaker at the beginning of the workshop really helps people to start feel a bit more relaxed about working together. But once people do take the courage to step into those other shoes, they find it very beneficial. And also hearing from other students in this particular case, just sharing again about real situations they faced, having that chance to really air them, debrief them, talk about, what might be good in those situations, what might have been better, what could have gone well. And the role play in itself, people found that really interesting. It was a very different way of looking at things for some people. And then some of the other, this was a shorter workshop that we did in the University of West of Scotland. And even though this was just a 1-hour workshop, you can see that, there was a very useful session. made me aware of my role and my failings and how I can improve. So that might sound quite negative, but in some ways, if we're aware of something that, oh gosh, I've been doing it in this way, maybe that's not the best. To become aware of that is helping somebody to, you know, to improve what they do and to become the best they can be. And that's a really positive thing. We all can learn that at different times in our lives. Great. I'm not great at role play, but it demonstrated the feeling of each role and the challenges. And that's a good point, because it's not about being a great actor or getting really into character. It's about really just sort of engaging with it, thinking about it and having a go. And it really can help open discussion. That's the key of it, really. Put consent and real life limitations into perspective, and somebody loved the role play. So that was just after a 1 hour workshop. That feedback was really positive for us.
So far, the feedback we have shared with you was based on our workshops with student midwives, but we were lucky that both in 2022 and 2024, basically just last week, we had an hour slot in the maternity and midwifery festivals in Scotland, where we invited both practicing midwives and student midwives to this session. And these are some of the feedbacks that we have received. They said fluid, flexible, with opportunity to explore ideas autonomously. They recommended the workshop, saying it gave great perspective. First-hand experience of the challenges and lived experience of service users in need of translation, which I find interesting because obviously these were improvised situations, but it still gave them what it might feel like. It's the first-hand experience of these challenges. Good information on intersection between culture and language and power dynamics. The power dynamics that are in place between, for instance, the midwife and the interpreter vis-a-vis the partner, whoever plays the role of the partner, they often say they just feel quite useless standing there in all that interaction going on. And the power dynamics that might be between other healthcare professionals and the midwives. They said they enjoyed the mix of activities and the involvement of the audience rather than them having to carry the weight of the improvised role play. They were happy immersing themselves in the role. They highly recommended it. And some people loved the icebreaker and the opportunity to pause midway through role play to discuss thoughts and feedback. And I think that is one very valuable part of these workshops. In the very busy environment of, for instance, the labor room, there is no time to sit and think about what's going on there. But the pauses throughout the role play is giving people the chance to be more open about how they might be feeling in that particular moment, rather than pushing that feeling aside and not being able to come back to it just because they're so busy. And normally they don't have these cross-professional discussions with interpreters. For instance, the healthcare providers do not necessarily come into the same room and talk with the interpreters who interpret for them. But this kind of environment gives them the chance to discuss issues in not only interdisciplinary way, but also cross-professional way.
So I think the key things that it's important to say is the workshops generally raise more questions than answers. And that's one of the interesting features about them. At the end of these workshops, we haven't provided particular answers about this is the way to do it, this is what we should do, here's a solution. But what we've created is a dynamic conversation where people can think, okay, hang on, I hadn't thought about it like that. Oh, how would we resolve that going forward? And I think it's when we start to raise these questions, start to be aware, as has been noted there, about maybe the needs of other people in different contexts, or the other characters or roles within each scenario. When we start to be in those shoes and think about it, it helps us to question that, explore that. And it's only when we start to do that that perhaps we start to explore ways forward or to have more conversations with other people. So it raises questions, but hopefully that leads to more learning, more creativity, more exploration. But it does also, even within that, increase a level of confidence and knowledge. And we, as I say, we do have a resource list that we provide. It's very basic because the the resources that exist around, and this is around the UK, not just in Scotland, are very varied and of variable quality, but we're trying to gather together that. And the conference that was held in Edinburgh in September, which we don't have feedback from at this particular point, some of the participants there were a mix of actually obstetricians as well as midwives. There was a much wider multidisciplinary presence, and they provided 3 or 4 new resources that we had. So we keep trying to build on that when we meet with people, which is really good. And I think some of the key thing that role play, while some people would go, oh no, I don't know, it's a bit challenging, not sure I want to take part in that, that everybody who did and everybody who observed said it was really worthwhile and really opened their eyes to situations. So we do believe that this unscripted role play has something valuable to offer. And then just the chance to explore stories and perspectives. And again, if we have a little bit longer than the 1 hour, we can take that forward, from this hour, we can take it forward to really getting those conversations going and understanding and exploring what might be possible going forward. Some of the feedback has been in terms of improving workshops to have more scenarios. Well, that helps if we have a little bit more time. Some practical suggestions about ways forward, which we are starting to build in. And definitely more chocolate, we were told, which I think we failed to do in our last workshop. So apologies to everybody there.
Thank you very much. We are open to your questions.